Welcome to the session, Health Systems in the Era of Climate Change and Planetary Health. My name is Amanda Quintana, and I am currently a research degree student at the London School of Hygiene and Tropical Medicine, looking into the implementation of climate-resilient health systems, specifically in lower middle-income countries. I have the great pleasure today in moderating this session, where we will hear about research and practices in this critical and often disregarded intersection of climate change and health systems. As the impacts of climate change continue to affect the health and well-being of individuals and communities, especially the poor and marginalized, we cannot ignore the impact long-term climate variability and change currently has and will continue to have on the systems that are meant to protect and support the public's health. Our experienced panelists will each present their work, showcase various insights from related disciplines, and identify research gaps and opportunities in this interdisciplinary area. Just some quick housekeeping. Please write your questions in the live Q&A chat box and any comments in the discussion forum. We will start with presentations from everyone and then engage in a live Q&A at the end of the presentations. We'll jump right into our first speaker, who's Upasana Ghosh. She's a senior lecturer in the Indian Institute of Public Health, also has a PhD in sociology and anthropology from the West Bengal State University in Calcutta. I'll hand it over to Upasana now. Thank you.
Many thanks, Amanda, and hi everyone. Am I audible now?
Yes, you are.
Yeah, okay. Yeah, so we are gathered here to talk about climate change, and it's a worldwide phenomena, as we know, but it has a lot of local impacts, very cascading impacts, and creating uncertainties in the life of the people at the very ground level. So today I'm going to present the case study of Indian Sundarbans, one of the climatically vulnerable region in India, the coastal delta, which is very rich in biodiversity, but unfortunately getting the climate change impact since last 40 years. Next slide, please. If we see the entire environmental impacts across India, it's obviously one major impact is heat waves, changing precipitations and intense rainfall, sea level rise, especially in the coastal Indian coast, eastern regions, which leading to frequent episodes of floods and droughts at the same times. It has indoor and outdoor air pollutions and a severe water scarcity and contaminations. So all these impacts India is presently dealing with, and it has a lot of pressure on the health system to deal with this kind of sudden changes, long term and as well as sudden. Next slide, please. So when we are talking about Sundarbans, it's land for geosocial marginalizations from the colonial period, and it has lots to deal with frequent flooding, sea level rise, high erosion rate, land erosion rate, and unpredictable and erratic rainfall. The intensity of the cyclonic events has increased at least 20% in last 13 to 15 years, and it has a kind of every year it is getting cyclonic events. Next slide, please. So the climate change manifestations have lot of impacts on the socio-economic life of the people. It has the crop loss, it has the loss of the cultivable lands, it's breaching of earthen embankments, uncertain shelter, making people's life very uncertain in terms of their shelter and livelihood. And it has a coping mechanism. People, especially the males, are seasonally migrating out of the island for looking for alternatives, which eventually give rise to the woman-headed households who have to take care of livelihood and caregiving stressors. Next slide, please. So how we conceptualizing this study is like that. In this background, the food and nutritional security of the children is getting hampered by depleting all the factors of food availability. It's basically the food productions, it's food availability in the market, it has the food stability, and it also the utilizations of food care resources. So it's basically we focus on generating some local level evidences to explore the health and nutritional condition of the children, as well as how people and the systems are responding towards that, and how we can make the nutritional and food care systems more resilient towards these climatic adversities. Next slide, please. So methodology we use, it was a cross-sectional mixed method comparative study. We took 3 islands and divided them into we make a gradations in terms of climatic vulnerability of that 3 islands. We did a household survey and with the nutritional anthropometric measurements of 0 to 6 years of children. We talk about experience of climate and climatic extremities on the food and other resources. We assess the food security in the households, both for child and adult. And we also ask people about how migrations is affecting their food security of the household. In qualitative parts, we have in-depth interview with the public and private health and nutritional care providers, and also with the mothers and other caregivers, how they are dealing with the children's caregiving amid this climatic adversities. Next slide, please. So the results, the findings come up with like 25% of the households has faced in last 5 years uh, extremely high losses of food resources due to these climatic events like floods and cyclones. Both households and child food securities are insecurity levels are very low, where at high at 66% and 44% respectively. Food insecurities are positively correlate with the climate and social vulnerabilities of the households. Here, I would like to mention that, in India, we have a social hierarchies like caste system. It's based on your occupations and based on your the social hierarchies. The health inequalities emerge. So this is the present scenario of India, and we also found that the social vulnerability like caste and religion plays a major role in terms of people's coping with the food insecurity. So 32% of the households borrowed from food from others, while 62%, almost all the families have to borrow money to buy food because the local availability, local productions of food is getting hampered. 30% of the children are chronically malnourished in climatically vulnerable households, while 38% of the particularly socially vulnerable caste households are food insecure in compared to the general households. So only 10% of the children aged between 6 to 23 months receive the minimum number of feeds per day as per the guidelines, while no child with minimum number of dietary items recommended are getting for the infant and for the IOICF guidelines. So choices, the food groups of choices is really shrinking, and people are just living on the carbohydrate and pulses, which is again provided by the government public distribution system. Because as the resources, as the market availability are getting hampered by these frequent climatic events, people have to rely on the public distribution system, which is only giving them options for rice and pulses. Next slide, please. So this is the scenario of malnutrition. When I weight it in terms of climatic vulnerability, it shows the households which have highly vulnerable to the climates. It has all the malnourishment, all the undernutrition, stunting, and wasting figures are actually positively correlate with the high climatic vulnerability. Next slide, please. So child malnutrition and food security nexus, giving these children more and more, insecure in terms of food, in terms of their nutritional security. So if we compare the prevalence of underweight and prevalence of stunting in terms of malnourishment, so the food security, the households which are low in food security, it is very obvious that the prevalence of stunting and child malnutrition are getting very high. We also did a food security, food choice, food diversification exercise with the community, and it has shows that they are basically very low in terms of fruits, in terms of vegetables, in terms of protein, and the children are getting towards a chronic malnourishment. Next slide, please. So in terms of morbidity status, we only take the water related diseases because as a flood prone zone, it was very prominent, climate sensitive disease there. So as we see, that's the prevalence of waterborne diseases, water related diseases are very high in the households which are facing the climatic vulnerabilities, and the entire children of the Sundarbans are actually very high in terms of water. The prevalence of waterborne diseases is very high in the children of Indian Sundarbans when we compare to the average of the state. The state is state average of waterborne diseases among the children is 5.9%, where we can see its average illness in the year in all three study areas. It's over, it's much more than the state average. Next slide, please. So not only the people are facing challenges in terms of climate change adversities, but also the health system, the nutritional care systems, like the integrated child development centers, where the children can come and especially the pregnant woman and the children below 5 years, they can come, they eat, and they play with a minimum school kind of literacy. They get that center, but those centers have to be stopped during, especially during this emergency of flood and cyclones. And not only a major cyclonic events is needed, but every year during the monsoon times, the entire 3-4 months, these centers have to be closed because there are very very few centers which are basically climate resilient. So these are the challenges faced by the healthcare system itself. Next slide, please. So when we talk with the providers, they come up with certain points that what we need to think about reimagining our healthcare or nutritional care system in a local settings, which is facing the climate change. It's like the infrastructure and governance. There are lack of sustainable and climate resilience care infrastructures. There is no surveillance systems to monitor the environmental exposure, which is related to children's health or impact on food system. The health workforce capacities, basically the knowledge of health workforce is very limited, that how much this is related to climate and how much this is related to the a sudden event like a disaster. So resilient planning is basically very much lacking in terms of whatever the implementations is happening in programs or in terms of any schemes or policies. Adaptive management is basically, this is something that what we need, but in terms of information and communication system, in terms of risk assessment, there is a huge lack what we find. So and the most important is there is a very much lack of the community voices. People are basically very much people are busy, people are prioritizing their livelihood because they always have to be in uncertainties that what they are going to do to the next day to earn their life, earn their earn their livelihood. So that uncertainty is making the demand for the communities a very less, and which is in a way impacting the accountability of the health system to respond better. Next slide, please. So what the recommendations the study gave is like, first, we need to recognize climate change as a significant determinants of nutrition, food security, and health while formulating our policies and programs in a region like Sundarbans. So it's not a state, or it's not a, it's a very localized impact, but it has a severe impact, which is impacting the health and nutrition of the 5 million people. So long-term community-led adaptation strategies. Communities are all the time, doing something to cope with these changes, but their effort, their practices are not reflecting in the policies, which is very common in other third world countries scenario also. So, so prepare the already existing innovative measures like telemedicine center, like the nutritional care centers. Make We need to make them more climate sensitive and climate resilient. We need a strong surveillance systems to monitor the growth, especially for the young infant. Uh, I mean, during this monsoon period and the year the children face, the region face disasters like a big cyclone, moderate to big cyclone. We need climate sensitive infrastructures, and we need, and last but not the least, we need to bridge the gap between the community voices and their experience to envisage a better future for the children. Thank you so much.
Thank you so much, Upasana. Next, we have a presentation by Renzo. Let me pull this up. Renzo Ginto. You all see my screen? Yes? Great. So next we have Renzo Ginto, an associate professor of the practice of global health and inaugural director of the global health program at St. Luke's Medical Center College of Medicine in the Philippines. He's also the chief planetary doctor of Planetary Health Lab and commissioners of both the Lancet Chatham House Commission and of the Next Generation Advisor of the Lancet One Health Commission in University of Oslo. Over to you, Renzo.
Thank you, Amanda. And it's great to be joining this esteemed panel, even if it's close to 12 midnight here in Manila. And let me share my screen, and I hope you can see it now. So for the next 10 minutes, I'll be talking about my project, which is actually my doctoral dissertation when I was at Harvard, although I've already since moved back to the Philippines, as you mentioned, Amanda, to establish the first planetary and global health program in the country. And my study focused on the local health system responses to climate change as manifested in 2 coastal municipalities in the Philippines. I always say that the Philippines is at the heart of planetary health. You often hear of the typhoons and the natural disasters that our country confronts annually. And it is at the heart of the planetary, at the heart of planetary health, at the heart of the climate crisis. If you notice, they also share the letters P and H. And indeed, it's at the heart because, as you can see in this map, this is Southeast Asia, one of the climate hotspots in the world. In this map, you can see the redder the country is, the more vulnerable to climate change the country is. And unfortunately, the Philippines is the reddest of them all. And what are these different climate-related risks that this country, that the Philippines, is already confronting? As you can see, it's not an issue for tomorrow. It's already happening now. In the Philippines, you will witness the fastest rate of sea level rise in the world, as mentioned in this article, 5 times that of the global average. And as I've already mentioned a while ago, you know, the natural disasters that happen in the country annually, they are increasing in frequency and severity. And as you can see, when a typhoon hits, you know, a community, for instance, this was taken in 2013 when Typhoon Haiyan hit the Philippines, the strongest typhoon to ever hit land in human history. It's not just the infrastructure, the sources of livelihood, water systems, but even hospitals are being disrupted, if not destroyed. And as mentioned in the front page of our newspaper the following day when that disaster happened, it's the worst disaster to hit PH. PH, as you already know, is a nickname of the Philippines, but also I think it pertains to people's health and planetary health. And so, you know, with these realities that I have been, you know, seeing in the country, for several years already. I am really intrigued by this question. Are we ready to build health systems that consider the climate? And that's from Susanna Mayhew of the London School of Hygiene. And that really animated my work. And there are several tools already existing that try to bridge climate change and health systems, planning and programming and design. And we are yet to see a much wider adoption of these tools. But also, I think these tools are less, applicable or are still need to be really used at the local level where, climate change and its health effects do manifest, and where we really need to build strong health systems to be able to confront, these emerging challenges. And so in my project, I developed this analytical framework that brings together health systems and climate and health concepts. For instance, climate and health vulnerability. What are the sources of vulnerability? The projected health effects. And then, for instance, when it comes to health system, and I'm not going to belabor you with the details of this diagram, you will see, the 6 building blocks of the health system as, articulated by the WHO. But also there you will see, I'm also looking at the software of health systems. And that's actually coming from the work of Kabir Sheikh and others, that health systems are not just built of the hardware elements, but also of the software elements like leadership and power and agency and values and norms. And then you will see there at the bottom left, not just the health system, but we also need to look at what we call systems for health. What are these other sectors that contribute either to the creation or the destruction of health, whether it's the environmental sector, the agriculture, food sector, social welfare, etc. And in this project, we look at 2 different sites, 2 different islands in the Philippines, as you can see there in the map, which share a lot of different characteristics. Coastal municipalities, they're rural, high poverty communities. They're both affected by Typhoon Haiyan in 2013, but they also are 2 communities that have started some climate-related initiatives, not in the health sector, but in other sectors like agriculture and disaster risk reduction. And so when we look at these 2 communities, and we did a qualitative research design, with interviews and document reviews and field observations, we were able to map out, as you can see in this diagram, the different vulnerabilities and exposure pathways, and ultimately the health impacts, both the current and the anticipated ones that are present in these 2 coastal municipalities / islands. And when we look at the health systems and the systems for health in these 2 communities already affected by climate change, already started some climate-related initiatives, there are some common themes that we found out. There's moderate level of climate awareness post-disaster. It's interesting because in some places in the world, there's still some climate skepticism still going around. But here in these 2 islands alone, there's a very high level of awareness, positive values, and survivor mindset, despite all the adversities that the communities are facing. Unfortunately, weak baseline health system capacity and performance. They're unable to address the pressing issues, but also, which is a sneak preview of what they can do and they cannot do when climate change worsens. We see the role of local governments as frontliners, but also facilitators of these conversations around climate and potentially their impact on health. The importance of top leadership. It can't just be the municipal health officer or the environmental officer that is working on climate change. It should be the mayor, the top leaders, the council, all committed to this cause. And then we see some activity in other sectors, not necessarily in health, but hopefully these other sectors will help encourage the health sector to be more involved in climate adaptation activities, for instance. And then, of course, we see some elements of community participation and also cross-sectoral partnerships. And then here in this diagram, you will see, and I'm not going to detail, what can local health systems do in terms of addressing the social determinants of vulnerability, enhancing the capacity of the health system to be able to withstand climate-related shocks and stresses. And of course, it's important to improve the baseline health status of the community. And, Upasana mentioned about nutrition. We need to make sure that those health indicators are high. Otherwise, there'll be limited adaptive capacity to future climate change. And adaptive capacity is a concept that we don't use much in health systems, but is very much used in the climate and sustainability science. And we tried here to identify what are the determinants of local health system adaptive capacity. And I'm not going to detail, but you can see it's not just, as I mentioned a while ago, the material assets, the infrastructure, or the medicines, are they available in the health facility? But we're also talking about, leadership, innovation. Is the community able to come up with, homegrown solutions to the various health challenges and others that climate change is bringing? The importance of social capital, the community, and also intelligence. And when we say intelligence, it's not about information systems, is there community intelligence and climate awareness among families and households? And we also saw some of the tensions and the challenges that these local health systems confront. And I'm not going to detail here, but you will see, do we need to build new capacities, or we maximize what is already existing in the health system and in the community? Do we come up with targeted approaches to specific health problems, or should we come up with a much broad-based approach to be able to address different kinds of shocks and stresses, including the ones brought about by climate change? And I think this is becoming much more important now that we have COVID-19, another form of external shock. And, the Philippines is a country that has committed to the achievement of universal health coverage. And here, and I'm not going to detail because this will also be elaborated by one of our other speakers, really there is a growing conversation around the links between universal healthcare and climate action. We need both. We can't have one and ignore the other because, the other is so important for the success. For instance, we need climate action in order for universal healthcare to be successful, and both of them are critical in for the improvement of health and health equity in these communities. And now, I think what we're realizing is we need health systems that are not just universal and high value, high quality. Patients come out of the health facility not sicker, but healthier and happier. But also the health system should be climate smart. And, they're both adaptive to the effects of climate change, but also responsible in the provision of healthcare. And we have another speaker here that will be tackling the topic. And of course, in this era of COVID-19, we're realizing we need these health systems, even in these local communities, in these coastal municipalities, to be pandemic resistant. And finally, I think, we have a policy environment for this agenda, to proceed. And I'm not going to detail, but as you can see, some of the familiar frameworks from the Paris Agreement to the Astana Declaration on Primary Healthcare to the Universal Healthcare or Coverage Political Declaration signed by the United Nations. And so what are the key messages? So now we're seeing that, we need to include climate change into the health system equation. And there is a need to translate all these ideas and lessons into tools and disseminate them so that communities, municipalities, local health systems can learn and be prepared for the climate era. And we need these health systems, in this new normal to not just be universal and high quality, but also climate smart and ready for stresses and shocks, including climate change and COVID-19. Because our health systems may be able to overcome, the future waves of COVID, but if we delay climate action now, we can anticipate not just waves, but tsunamis of climate-related health consequences in the future. So together, let's advance the health of people and planet. Thank you for listening.
Thank you, Renzo. Wow, that is a really powerful graphic that you just showed. And I think it definitely speaks to this topic really well, that these are things that are coming down the line, things that are, we are anticipating, and we need to prepare for them, especially health systems. So next we hear from Renee Salas, who is a lead author, The Lancet Countdown on Health and Climate Change Brief for the US. She's a Yerby Fellow at the Center for Climate and Health and Global Environment at Harvard School of Public Health, and an affiliated faculty of Harvard Global Health Institute, and an attending physician in emergency medicine. Over to you, Renee.
Thank you so much for that wonderful introduction. And it's such an honor and privilege to be here with this esteemed panel. So, and thank you for joining us. So I think Renzo set me up enormously well in the sense of I'm going to dive a bit more into this intersection between two sustainable development goals. So 3.8 and 13. And really, I hope throughout the next 10 minutes can help to show you how climate change really threatens our achievement of effective universal health coverage. So with that, we're going to try to tackle three questions. The first is, so how does climate change threaten universal health coverage? And I'll dive into 5 pathways. The second is, who is most vulnerable? And I'll highlight a map in order to exhibit that in some work that we've done. And then the most important question is, how can we move forward? And I think that this discussion will also echo a lot of the themes that you have already heard and you will continue to hear throughout this session. So when we think about universal health coverage, what is it that we want? Well, in my mind, there's sort of 3 key things. We need it to be accessible to all. We want to provide the optimal quality, but also have to balance that with making it affordable. So if that's our ultimate goal, though, if we think about how climate change is, again, as greenhouse gases rise and are creating, I highlight just a few of the exposure pathways here, but rising temperatures and more extreme heat waves, intensification of extreme weather, and higher sea levels, then universal health coverage is threatened, again, through 5 different pathways that I'll describe. So the first is that there's changes in disease burdens. The second is that there's population displacement and migration. Third, that there's rising poverty. Fourth, that there's disruption of healthcare infrastructure and care delivery. And fifth, that the healthcare workforce is actually disrupted and potentially impaired. So let's dive into the first one. So changes in disease burdens. So first off, we know that non-communicable diseases account for 71% of global deaths in 2016. And 3 of these top causes are actually directly exacerbated by climate change. And that's cardiovascular disease, chronic respiratory disease, and diabetes. Second, when we think about infectious diseases, we know that a variety of infectious diseases are climate sensitive, including, for example, malaria and dengue, as has been reported on annually in the Lancet Countdown Global Report. And the third piece is thinking about occupational hazards. So for example, heat has actually been linked with a higher rate of work-related injuries for both indoor and outdoor workers. So thinking, what does that have impact for UHC? This could increase in utilization, so use of services and costs. And it also makes determining sort of the appropriate coverage of essential services more difficult. The second piece is thinking about the displacement and migration. So it has been estimated that 143 million may be displaced by 2050 in just 3 regions. Thus, if we think about it on a global scale, it's much higher. And this displacement can be driven by sort of, 3 things here as examples. So property loss, resource shortages, and conflict, highlighting that this is a really complicated and multifactorial issue. But recognizing that these displaced populations have likely very distinct health-related needs, and especially thinking about cultural related influences that need to be taken into account in new regions. And then also recognizing that flows of patients could be really dynamic and that there could be rapid shifts and increased patient volumes in certain areas. The third piece is thinking about rising poverty. So again, 100 million additional people are estimated to be thrown into poverty by 2030. And again, I would argue this is also potentially a significant underestimate. But thinking about those mechanisms, again, sort of loss of property, decreased crop yields, and increased health burdens as a result of this. So what does that mean for UHC? Well, again, can be higher burdens of diseases, and also recognizing that there may be a greater financial assistance that's required from governments as they think about how to financially structure their UHC within their country. The fourth is disruption of healthcare infrastructure and care delivery. I mean, you've heard examples of this, and unfortunately, there are probably likely examples that you've witnessed in your own environments, but this can range from infrastructure damage, from facilities being damaged, to power outages. We recently just had a polar vortex down into Texas, which is a part of our country that is not used to extreme cold temperatures. And this led to power outages and loss of water at hospitals that required evacuation. We also think about supply chain disruptions, like, for example, after Hurricane Maria in the US, we had a pretty widespread shortage of intravenous saline. And this is water in a bag. So thinking about what these other impacts could be. Thinking about transportation, both getting patients to the hospital, as well as thinking about workers being able to get there. And then thinking about what that actually can, disruptions can occur within our public health and disease surveillance capacities as a result of these instances. So again, this can prevent us from providing the high quality essential services that we all esteem to do, lead to individuals being unable to access care, and leading to potentially additional cost burden on the health system, and also sort of shifting where those financial burdens are. And the fifth piece is thinking about the healthcare workforce disruption and impairment. So there is evidence that there's actually cognitive impairments when individuals are operating in an environment with extreme heat. And so thinking about individuals who are practicing where there is not temperature controlled environments. Again, also having an inability to report to work due to physically being able to get there, or even potentially, having their own sort of family related issues that they're dealing with as a result of whatever has struck that region. And then also recognizing that the knowledge gaps potentially are going to continue to grow as certain diseases move into new and novel regions, and thus recognizing that there really is a dynamic educational imperative that we have to provide in order to make sure that individuals have the latest information to provide optimal care for their environment. So again, this can lead to provider shortages, especially in areas that may already have existing shortages, and then also could lead to a lower quality of care and ineffective disease surveillance. So those are kind of the 5 areas. And then I want to move to the second question, which is who is most vulnerable? And I think one of the key things that I really would like to highlight on this map is to zero in on the yellow aspects. And I think the goal and takeaway of this is that the countries that are most vulnerable to climate change are often those that face the greatest barriers to achieving UHC. Now, this probably isn't surprising given that, both are related to a country's economic strength and sort of availability of resources. But if you look at, again, the map here on the left that highlights the climate vulnerability, and again, countries that are yellow exhibit very high vulnerability. And then this is the UHC index, which describes, as many of you know, sort of the effectiveness or the ability of a country to achieve UHC. And that is also highlighting that countries with very low UHC indexes are yellow, and purple, again, are sort of the exact opposite contrast on that continuum with very low climate vulnerability and very high UHC index. Now, recognizing here that this means there's an enormous opportunity in order to integrate these two agendas, and that I would argue that it is critical and essential, and we cannot achieve one without achieving the other. And so how can we best move forward? So I want to kind of propose 5 different areas and just highlight one example in each of these. And this work is outlined further in an article in the BMJ, and would encourage you, if you want to learn more, to reference more information there. And the first is really to try to have an improved understanding and sort of integration of these agendas. And so, for example, trying to understand how these shifts in disease burdens will really impact one's ability to access care, and how that potentially will shift the needs of a healthcare system. because most of these questions are really on the cutting edge of our understanding, which for all the researchers out there means there's an enormous opportunity to help us all collectively understand this. The second piece is to think about novel financial frameworks. This can include, for example, using carbon pricing that includes climate-driven health and healthcare system costs, and recognizing that there are these downstream costs that we have to start considering. The third one is thinking about climate change mitigation. You will hear more about that within the healthcare sector. But thinking also around how we can really frame our transition to renewable energy as health benefits, and the fact that it is actually a prescription for improved health and our ability to achieve health equity. Fourth is recognizing that, as we adapt to climate change, we need a data-driven approach to understand who is most vulnerable so we can allocate resources in the optimal way possible. And in addition, we need to think about how we can better train our health professionals and create a dynamic workforce that can respond to the challenges that are going to be really specific for each region. And again, can really ebb and flow depending on, for example, extreme weather. And fifth is thinking about health system resilience. So thinking about how we can map out the different threats for each region and really looking to build in those resilience so we can maintain infrastructure and power and maintain our supply chains. But we can't prepare for what we don't optimally understand. And so we, again, have a huge knowledge deficit that we collectively need to work towards, and look forward to working with all of you in order to achieve that. So back to my 3 questions. So, how does climate change threaten UHC? Again, I hope that at least the 5 areas that we dove into help to give you an example about this intersection as a proof of concept. So again, there's changes in disease burdens, there's population displacement and migration, rising poverty, disruption of healthcare infrastructure and care delivery, and healthcare workforce disruption and impairment. Second is recognizing that who is most vulnerable, that generally the countries that are most vulnerable to climate change have the lowest coverage of essential health services, which means there's an enormous opportunity to integrate these agendas. And third is recognizing that UHC plans have to consider how climate change will dramatically alter the context in which we're working in the future. And working in now, because we can no longer rely on a rearview mirror to understand it. We have to recognize that we have an unprecedented future, but we have the tools to do it. And I look forward to doing that together. Thank you so much.
Thank you, Renee. That was great. Giving us a little hope there that we can still work towards finding solutions, of course. So next, we're going to hear from Josh, and I'm going to pull up my screen. We're hearing from Josh Carliner, who's the International Director for Program and Strategy at Healthcare Without Harm. He established and developed the Healthcare Without Harm's Global Green and Healthy Hospital Network and headed Healthcare Without Harm's Global Mercury campaign. He has more than 30 years of experience leading organizations and working in international environmental health and social justice issues. Over to you, Josh.
Thank you very much, and hello everybody. It's good to be here. I want to especially thank Renzo Ginto for organizing this event. I'm glad to be able to join you today. I want to try to talk a little bit. I've been asked to sort of talk from a more sort of global top-down perspective, if you will, about this issue. And I also want to talk a little bit about solutions. So, we've heard from the other panelists that climate and health crises are converging in many ways. And I'd like to suggest to everybody that our responses must also converge. And in order to do so, we need to sort of take a basic health approach on this, which is we need to prevent and we need to prepare, and we need to do so with equity. So we need to mitigate climate change, and we need to be resilient and adapt to climate change as the health sector, while at the same time meeting global health goals. I'd also like to suggest that the current pandemic and the response to the pandemic and the recovery efforts around the pandemic provide an opportunity for us to begin to merge our responses to these two very important global issues, climate change and health. Okay, so now there we go. Okay. Another way to look at this is that we need to align the health sector and healthcare with the ambition of the Paris Agreement. We need to simultaneously strive to protect public health from climate change while meeting global health goals. And I think we're at a really interesting moment right now in the world, in that for those of us who have been working on climate change and health for a number of years, and there's several of us on this panel who have been, this issue is opening up, and the connections, especially given the pandemic, the connections between environment and health and climate and health are clearer than they ever have been to a broad cross-section of people and policymakers. So folks working on the climate issues are seeing health as important for the first time. And folks working on health issues in the midst of this pandemic are also seeing the climate crisis looming as the next big threat and crisis. So we're at a very, very interesting moment in that there is an opening to make some of the transformative systems change that we need to make to meet both of these big climate and health goals, to address these huge challenges that we face in the world today. So I want to talk a little bit about another aspect of this challenge, which is that in addition to people's health being impacted and health systems being impacted by climate change, healthcare actually contributes to the climate crisis. In a study that we did in 2019, we found that 4.4% of net global emissions come from healthcare. And of course, the unequal nature of the world and the unequal nature of countries' contribution to the climate crisis is also reflected in the healthcare sector. And that if you look at this, the wheel there on the lower right part of the screen, you will see that the United States makes up almost a third of global healthcare climate emissions, followed by China and the European Union. Together, they make up half of the world's emissions. If you add the other countries listed there, it's 9 countries plus the EU make up 75% of global climate emissions. At the same time, every health facility, every health system, every hospital emits carbon. And if we are to move toward the ambition of the Paris Agreement, and if we follow what the governments have agreed to in the Paris Agreement, every country needs to do their part, and therefore every health system needs to do their part. And so based on this report that we did in 2019, we took one of the recommendations from this report to develop a global roadmap for decarbonizing the entire healthcare sector around the world. And this is a roadmap that we've developed, and we are going to be releasing out into the world next month on April 14th at an event at the Skoll Virtual World Forum that will start at pretty much exactly about this hour on April 14th, so you're welcome to join. And it's a navigational tool for achieving zero emissions with climate resilience and health equity. So it's looking at how these issues interplay and really focusing on how all countries can do their part to decarbonize the healthcare sector while achieving UHC and while preparing for the impacts of climate change and becoming more resilient. And so it takes a sort of a global climate justice approach, if you will, in that the most polluting nations must reduce their emissions the most quickly, and those least responsible for the problem and those that need to invest in their health systems to actually achieve better health also need to do their part, but at a different sort of trajectory and a different track. So this is a snapshot of what the global roadmap finds. So if you look at the lower left corner there, this is a bit of a preview for the release next month. healthcare's emissions in the study that we did in 2019 found that in 2014, they were 2 gigatons. That means that if healthcare were a country, it'd be the 5th largest climate polluter in the world. And if we continue with business as usual, with no climate action, we project through this roadmap study that we did that healthcare's emissions will triple by 2050, moving to 6 gigatons a year. The good news is that if governments implement their commitments, their climate commitments that they made to the Paris Agreement, their nationally determined contributions, up until 2017, the commitments they've made up until then, 70% of that growth can be eliminated. The challenge is, as we know, governments have not necessarily implemented their commitments. And so if the health sector, this is an important piece here, if the health sector is going to actually do its part to address the climate crisis, it needs to advocate for the implementation of those commitments outside of healthcare's, the hospital walls, if you will. So there needs to be an intersectoral effort in which the health sector participates to actually achieve these broader societal commitments to decarbonization in order to decarbonize the health sector itself and to more broadly protect public health from climate change. At the same time, we found that if you look at this gray wedge, that there are a series of actions that the health sector can take itself in terms of facilities, healthcare delivery and operation, in terms of the global healthcare supply chain, and in terms of the deeper decarbonization of broader society to further bring down emissions. And then in that bottom wedge, you'll see what we call uncharted territory. And this is an area where we've not been able to model, but what we're finding is that there are a series of different initiatives, including, and I'll get to this later, implementing green UHC that can help move healthcare toward the aligning global health goals with global climate goals and helping keep doing its part to help keep global temperature rise to 1.5 degrees Celsius. At the same time, we just want to underscore that there's a lot of action happening on the ground. This isn't just an abstract roadmap, but this is one example of it. This is something that this infographic's actually old. It's from it can illustrate the pace of the action in that it's old. This is from 2019. There were 200 participants in the Healthcare Climate Challenge, which is an initiative that Healthcare Without Harm, my organization, runs. Those represented 18,000 hospitals and health centers from 31 countries. That's grown through the pandemic, it's grown. And so there are now more than 300 institutions in 40 countries representing 22,000 hospitals and health centers that are committed to climate mitigation, resilience, and leadership. Many of these are joining something called the Race to Zero, which Healthcare Without Harm is the official partner with the United Nations Framework Convention on Climate Change, Climate Champions, which is a commitment to zero emissions. So we will be announcing in late May a first wave of hospitals and health systems from every continent and from broadly different health settings and economic settings that are committing to net zero emissions by 2050 and a 50% reduction of their emissions by 2030. So hospitals and health systems and health facilities in every different kind of healthcare setting are starting to take action to move to zero emissions. And we're seeing national systems like England's National Health Service committing to zero emissions. And we're seeing health systems in places like India, for instance, in the state of Chhattisgarh, that are implementing 100% renewable electricity strategies to build greater resilience while at the same time decarbonizing. So I guess one of the last things I want to talk about here is several of the panelists have talked about how climate change impacts UHC. And I think the flip side of that is, and part of the solution is, that we need to develop the concept, and Renzo talked a little bit about this, of what we're calling green UHC. One of the ways to do that is to power healthcare with low carbon solutions. And by doing so, increasing people's access to health. Green UHC can also include, for instance, sustainable healthcare waste management and in a series of other initiatives that align sustainability and the expansion of health equity and access to healthcare. Again, it's the merging of the concepts and the approaches to health equity and climate justice that I think we need to further explore. And part of it is about, as the other panelists have pointed to, building resilience. And we like to think about resilience at 3 different levels. One is facility resilience, which several folks have talked about. One is systems resilience. And the other is how the health sector can contribute to greater community resilience by serving as an anchor for that community resilience, by investing its resources and engaging with the community to support better health, better nutrition, and better access to healthcare. And I guess the last thought I want to leave you with is that the health voice on climate change is really important. So not only is our health being impacted by climate change, and not only are our health systems being impacted by climate change, but again, the flip side of this is the health sector can be a protagonist in addressing climate change and in advocating for the transition away from fossil fuels to clean renewable energy that is central to both decarbonizing healthcare itself and protecting people's health from climate change all over the world. It can be a protagonist in advocating for solutions at the community level, at the local government level, at the national level, and the global level to make the changes that we need to make to, again, achieve the goals that we've set for the world, the Sustainable Development Goals around health, the Sustainable Development Goals around climate, and so many of the other Sustainable Development Goals that, that connect with that. So again, there is the climate change is a major health problem. It's perhaps the greatest health threat of the 21st century, as both WHO and the Lancet have put out there. And it is a tremendous opportunity for us to transform our systems, our health systems, so that they can address these huge challenges of this century. Thank you very much.
Thank you so much, Josh. I'll wait for you to stop sharing. Thank you. Yeah, so driving home that point on, seeing climate change not just as this threat, this imminent threat, but also as a global health opportunity, just like the Lancet Countdown had talked about in this most recent report. So next we're hearing from Bassel Daher. Finally, this is our last presentation. Bassel is a research scientist at Texas A&M and an adjunct assistant professor at the Department of Biological and Agricultural Engineering at Texas A&M. His work builds on the systems thinking to develop tools and analytics that catalyze evidence-based multi-stakeholder dialogues around trade-offs associated with technological, policy, and social interventions to address the interconnected research challenges. And soon he'll be also bringing in health into that picture. So over to you, Bassel.
Thank you, Amanda, for this introduction. And hello, everyone. Really excited to join this exciting panel. And thank you, Renzo, for this invite and for organizing this session as well. So today I'll try to, as Amanda said, I've been working on water, energy, food nexus research, and with working on that, we can't but highlight the importance of human and planetary health systems as we look at water, energy, and food security. 2020, I think, was a year that demonstrated how was a year of compound challenges, where we were facing a pandemic, a public health crisis, with compounded with disruptions to food supply chains, economic shocks, energy price shocks, and it was a demonstration of a wide range of challenges that are complex, interconnected, often hard to predict, and that are not unique to 2020. So in order to improve our preparedness to address these challenges as we move forward, this requires a high level of cooperation across different sectors, across different disciplines, and we saw that demonstrated as we responded and continue to respond to the COVID-19 pandemic this year with the cooperation of different scientific disciplines, as well as different stakeholders across different sectors. So in my presentation today, I'd like to share some of these complex challenges that we anticipate to face in the coming decades, and draw links to human and planetary systems. So in the coming decade, by 2050, we are expected to need 60% more food, 55% more water, and 80% more energy. And we will face those under continuing pressures of growing global population, which is expected to hit 9 billion by 2050, as well as different climate change, extreme events, and economic growth across the world, which will affect different regions of the world differently. And the challenge here is that as we address these challenges moving forward, we need to recognize how interconnected they are. 70% of fresh water goes to food production and agricultural production. 15% of water goes to energy production, and 30% of the energy is consumed by the food sector. All of that at the time where more than 840 million people still lack access to safe drinking water, 815 million people still lack access to food, and 1.1 billion still lack access to energy. And these challenges, again, will take different shapes and levels of urgency in different places, regions over the world, creating different hotspots that need to be addressed in a context-specific manner. And these resource systems do not exist in a vacuum. They are, in fact, managed, consumed, regulated by different players that also interact among each other. So as we look at different interventions, whether we're looking at improving different technologies, putting forward different policies, incentives, or raising awareness to shift human behavior, we need to also understand the interconnection that and the relations that happen between those interconnected stakeholders. And those interconnections and relations don't occur at one scale. There's also a multi-scale effect to that. And as well, we need to ensure that as we're putting together solutions, that we ensure that there's a level of coherence between solutions at different scales, so we don't end up advancing one goal at the expense of another at another scale. So reflecting on working towards achieving water, energy, and food security, human health really is at the center of that. And while we need to achieve those securities for better human well-being, we need to also be conscious of the planetary boundaries that we are constrained by. So as we look at water security, for example, we need to ensure that people have access to drinking water, safe sanitation. This is at the time where more than 1.7 million people still die today because of diseases related to unsafe water and sanitation. At the same time, when we're looking at allocating water resources and planning into the future, we need to make sure that we are ensuring enough water for ecosystem services and other systems as well. When it comes to food security, also we heard earlier today about the remaining challenges with food insecurity and malnutrition, especially with children in many developing countries. So as we look into food security, we need to ensure that people have access to proper food and nutrition, while at the same time, as we envision our food systems of the future, we need to make sure that the footprint of the agricultural system is also one that does not compete with other ecosystems as well. When it comes to energy security, also our choices of energy portfolio has a direct impact to our human health, with depending on how fossil fuel intense these energy portfolios are. So with a direct effect on human health and planetary health as well, with effects on global warming and other planetary systems as well. So to give you a specific example that I've been working on here in Texas, in San Antonio, which is home to a growing urban center in the city of San Antonio, which is surrounded by a growing agricultural sector, as well as hydraulic fracturing for energy development. So all the dots you see on the map are water wells. The blue dots are water wells for municipal use. The green dots are water wells for irrigation, and the red dots are water wells for energy. And we can clearly see the level of competition that exists between these three growing sectors in this region. As we did this analysis, one thing we did was also sent a survey to the different stakeholders, water, energy, food, and cross-cutting or planning level stakeholders in the region, to really look at the level of communication and cooperation that is happening between these regional stakeholders as they plan for the future resource allocation for the region. And what we learned was that more than 90% of the possible communications showed zero communication between water, energy, and food stakeholders. Most of the communications, as you see on the screen here, with the surveyed water public officials, were with other water players in the region, and much less with energy and agricultural players. And as we looked at more frequent levels of communication, we see that most of that network drops as well. And once we learned that and had a stakeholder engagement meeting with the regional stakeholders and asked about the reason behind that, they said that despite our knowledge about that tight competition between these growing sectors and the need for us to cooperate, the mandates, the institutional mandates at our organizations do not allow us to do this kind of coordination. There are no financial resources necessarily dedicated towards doing this kind of increased communication and coordination. There's a challenge with the uniformity of language across different sectors with different contexts and different possible solutions. Also a challenge in planning horizons, where we see shorter planning horizons for water sector, for example, compared to longer planning horizons for energy. Different value systems across sectors as well, with different goals and competition as well, with the lack of common goals and collaborative projects. So if I want to summarize quickly, and I'd be happy to share more during the Q&A, one of the things that we need to do as we address these highly interconnected, complex challenges is to, first of all, there's an important need for systems thinking, as well as investing in infrastructure for improving our resilience. And that infrastructure is not necessarily concrete or brick and mortar infrastructure, but we need to invest in environments that innovate at the interface of different disciplines. So to encourage interdisciplinary research across different disciplines, to allow for exploring those questions and allow for understanding those interconnections across different research challenges, which might lead to the emergence of new disciplines. We need to also invest in environments that innovate environments to innovate in ways that diverse actors can cooperate among each others. And last but not least, we need to also ensure that as we invest in both environments and encourage them to push towards more cooperation among each other, that we ensure a level of convergence between researchers and stakeholders as our understanding of these challenges and ways to respond to them evolves over time. So I'd like to end with, it was mentioned in previous presentations, but as we work towards the UN Sustainable Development Goals in the 10 remaining years, and with each of our disciplines, areas of expertise, and the goals that we are most passionate about, systems thinking is very important, and we need to really ensure that we are aware of the level of interconnection between the goals that we are most passionate about and others that are connected to it. So this is an image that I like to show the SDGs with, rather than showing separate silos. I think these SDGs are a network of different goals that are very much interconnected, and that would require us to move together and work together, collaborate together in order to achieve by 2030. Thank you very much, and I'd be happy to continue this conversation offline.
Thank you, Basil. All right, so we are transitioning now into our Q&A session. We had such great presentations from all the speakers that we only have 5 minutes left for our discussion. So I'm going to ask now if all the speakers could put their videos on as we transition in, and I'll open up with a question for all speakers. So whoever feels like jumping in and answering, feel free to. So we have a question that goes, with regard to climate change affecting access to healthcare, facilities issues specifically, it leads us to the importance of focusing on resilient health facilities, hospitals, and healthcare. How are health systems able to respond to climate change specifically? How can hospitals create climate awareness to communities? And how do we foster systems change that is aligned with the Paris Agreement? So that's a really big set of questions there, but whoever feels like jumping in, go for it.
Renzo, you had your hand up. Why don't you start?
Yeah,
Oh, I was signaling we'll have 5 minutes for 5 questions. But maybe, and you know, for sure we can't really cover that entire you know, list of questions. But you know, I'm just reminded of what Basil talked about. You know, the time frame, right? And I think that that's quite a very useful you know, concept. In the health sector, we're used to annual budget cycles, right? And planning for the next year. And I think now that, you know, we're putting climate change into the health system equation, you know, whether at the facility level or at the ministry level or at the global level, then we probably will need to start thinking of you know, a much longer term, you know, time frame. So for instance, when it comes to these health facilities, you know, how can we make sure these health facilities, you know, are able to provide what is needed? You know, I think we should not forget also the main function of health facilities, to provide essential health services that are of high quality. That's why I was, you know, reminding a while ago, we also cannot detach the climate smart health systems agenda from the high quality healthcare agenda, because we need to make sure that patients are still happy and healthier, you know, when they access healthcare. And so, you know, I think this is a new level, or it brings a new dimension to the discussion when it comes to building new health facilities, but also enhancing existing ones to be able to, you know, prepare for the climate, you know, unstable future, unfortunately.
Yeah, and I would just add really quickly, since we don't have a lot of time, to the questioner. Check out the WHO, the new WHO document on climate resilient sustainable health facilities. I think a lot of answers to the question are there. And also go to greenhospitals.net, which is Healthcare Without Harm's Global Green and Healthy Hospitals Network. And you can find hundreds of case studies from the members of that network from around the world on how they're taking on these issues.
And we have one question for you, Josh. I'm going to pick one of these, which is, you know, how can we begin to define what green universal health coverage means, or is what it is?
And I mean, I think that's, you know, Renee and
Renee,
Renzo and others can answer that. I mean, it's a good question. I think this is a brand new field, and you know, there's a lot that needs to be done to define that. And I think we need to look to examples on the ground and all around the world, and begin to sort of forge this vision, but we can't afford not to. But I'd pass it on to Renee.
Well, I'll just add sort of just one brief comment to kind of connect both this question and the last question. And that's that we need to make climate change personal for all of these stakeholders who think that climate change doesn't apply to them right now. And that's because climate change is a meta problem, meaning it underlies so many of the other problems we're facing, and a threat multiplier, meaning it's making it worse, that we can connect it to anyone. And we need to begin to make those connections so that way they see how it is truly impacting their goals. And if we can do that across the health system and do it in a multidisciplinary fashion, that's how we can bring us all together and collaboratively define green UHC together.
Great. And we actually have a couple more minutes, if that's all right with everyone, and still aligns with your time. I'm going to ask if each of you could also answer this next question. We'll just go around and keep it brief. But someone had asked us, what's one thing that you'd change about current health systems in your own country to be more sustainable? So I'll give you all a moment to think about that, but it would be nice if we can go around and each of us maybe say one thing that we find most important.
I can jump in. So, I mean, I'm from the United States. We have the most inefficient and obese health system around. We spend way more per capita and as a percentage of our GDP than any other country, and we have worse health outcomes than almost every other advanced economy in the world. And so the one thing that really change is to address that obesity problem. And by doing so, we could, by making our health systems more efficient and less wasteful, and again, greener, we can both reduce the climate footprint of healthcare while delivering better healthcare. So that would be like I think that would be one of the biggest things that we could do in the United States.
Thanks. Renee, do you have an answer?
Well, I mean, this question makes it sound like I have a magic wand. So if I can like magic wand and fix one thing, I mean, supply chains and just thinking about how we actually get materials to the hospital and how we use materials there. I mean, that is an enormous and the largest kind of scope as we think about. And so we just need to rethink how we do this. And so I would target supply chains.
Right. Well, for me, and because I'm from the Philippines, but also it's not unique to the Philippines, most countries have expressed commitment to achieve universal health coverage, but we know that it's UHC on paper and not in reality. And as we, confront, more health consequences resulting from climate change, we need strong and inclusive and universal healthcare systems to be built as soon as possible. But I really like the idea of green UHC or climate considerate UHC. And for sure, we need another webinar to reflect on that.
Hi, shall I go next? Yep. Sure. Yeah, so for me, that's India, it's a lot of health inequalities is already existing in terms of caste, religion, gender, so many. So climate change is just widening all these existing inequalities and making the health of the people more and more vulnerable. So if I wish to push the health system towards that, that's first you recognize that climate change is really happening in India, and it is in future, in very, very sooner future, it is going to, widening this gap. So recognizing and planning, I mean, we need to incorporate climate change planning in each and every sector, be it the social determinants, be it the core health system. That is the need of the hour in the country like India and other Southeast Asian countries. So maybe I'm hopeful that it would happen soon.
Thank you. Basil?
Well, one final quick reflection is on the fact that solutions to health system challenges might not necessarily come from within the health system itself. So as we better our understanding of the health system and its interconnections with other systems, we can find a lot of potential solutions that might come from different sectors that could improve the sustainability and the resilience of health systems themselves.
Absolutely. What a great way to end this session. Thank you so much for everyone also who stayed after the time. We really appreciate it. And we hope that you found, this session really lit up your mind a little bit to start thinking about this problem and, advocating for this really important, critical, interdisciplinary area of climate change and health systems. So any final words from the panelists, we will adjourn our session. Great.
Thanks, everybody.
Thank you, everyone.
Thank you.
Renzo, for pulling together this awesome session.
Yes, thank you,
Well, the real work has just begun.
Absolutely.
Let's do a
Go
quick
Green UHC.
a quick smile so we can screenshot this. All right. I don't know, Upasana, if you want to put your video on.
Sorry, maybe I will be unable.
Okay, we'll put your face in there. 3, 2, 1. All right.
All right.
Thank you.
Ciao.
Bye,
All right.
everyone.